Okay, everyone. Well, this is Michael, and this is the discussion in regards for the care of the home. Other than caring for a client at the itself, we also need to make sure we care for their home. Because as a homemaker, as a caregiver, as a home health aide, we need to make sure that everything is situated well at the patient's home so that they can actually have a good environment to be able to heal and better themselves. So let's go ahead and talk about providing a safe, clean, and orderly environment and how it's so important for them. So you have to understand illness and disability cause great stress. So the client will feel better physically and psychologically and will recover quickly when their home and even their families receive care and support. Remember, infections and accidents are always preventable, and by keeping things clean, by keeping things cluttered free, we can prevent them from happening. Now, families, unfortunately, who sometimes have lack of knowledge about how to manage their homes can be taught valuable household management skills. Your facility can actually have flyers and products or videos that they can present to the family members so that they are shown and can be aware of what things they can actually do. Now remember, clients recover more quickly when homes and families receive care and support. We need to remember that, and that's why we have to have a good home environment for the client. Now, there are several household management skills that we should make sure, and I can actually tell you that sometimes, unfortunately, we ourselves can't do this ourselves for our own homes, but when we're caring for someone at the comfort of their homes, these are things that we would have to provide for them, such as sanitation, safety, personal hygiene, nutrition, meal planning, food preparation, communication skills, specific healthcare techniques. These are some of the things that we would have to do for our clients that we're caring for. What is meant by the statement home health aides are role models in the home? You probably never heard this term before, but this is something that's floated around in the care of patients at their home. We are role models because we are the one that kind of gives the care for the clients. To be able to provide the right type of area, location, and services for them is what we do. And what we do is hopefully the family members will able to follow as we lead along. So we need to understand the qualities which are needed when working in someone's home. Okay, remember, you're by yourself most of the time. You may have a supervisor on the phone that is readily available, but when we are providing care, it's a one on one service. So we need to be efficient at what we're doing. We need to be able to follow directions and follow the plan of care that is placed upon us. We should be willing to be flexible. Not everything can happen in order. Not everything can happen the way we expect it. Now, not everything can happen the way things are planned. So we need to be flexible to adjust ourselves for anything that can happen in front of us. And also, we have to show sensitivity to the client, to the family members, and at the same time as to ourselves. So, how do we show sensitivity? Well, one thing to do is to respect a person's customs, their beliefs, their feelings, especially the client and even their family members. We need to know and understand that and also actually realize when it's appropriate to ask family for help. Remember, you're there to do a job at times, and there are things that's going to be required of you that you should try to do on your own, not unless you really need assistance. Remember that assignment sheets may include dusting, vacuuming, sweeping, laundry, changing the bed, changing the linens, changing dishes or washing dishes, cleaning the kitchen or the bathroom. You have to understand that this is part of the care. If you think that the care is only for the client, well, that's not enough when it comes to providing care at the home. We have additional duties, not just for the client, but what the surrounding area is, because we need to have a good surrounding area to provide care for the client. So, how would you feel about doing housekeeping for another person? Do you feel that it's very important for the overall care and the wellness of that person? Are there any tasks at home that you would rather not do? I know some people have said before they will never do wash dishes, they will never wash clothes. Well, if it is a requirement for you under the care that is actually given to the client and that is part of the plan of care, well, then it is part of your duties to be able to do that. So before working for a company, ask them, what are the duties required? Am I going to have to do this? Am I going to have to do that? These are questions you have to ask before you actually take a position later on. As a home health aide, the tasks that are needed to be performed are considered light housekeeping and not heavy jobs. You're not going to go in there and all of a sudden empty the whole house because they have, so much mountains and mountains of clutter that they're a hoarder and all those things. It's light housekeeping that you have to do. If the house is in disarray, then you have to bring in your team in there. You're going to have to talk to your supervisor and say, you know what, this is more than me. I'm going to have to spend my whole time caring for this rather than caring for the client. But that doesn't mean light housekeeping should actually be removed from the whole thing. So some of the housekeeping guidelines we should know is invite the family to participate. You're not going to be there 24/7. If there's family members, invite them to be able to help out. Ask for their input. When you're cleaning, use acceptable cleaning materials. What does the family have that they can provide? And if they don't have that, try to see how things can be provided. You can't just clean everything with water, right? You need disinfectants. When you're doing what you need to do, you need to be organized. Have weekly schedules, have monthly schedules for the care of the client. You're not going to be cleaning every day, but if you can actually do one area at a time, then eventually you'll have a clean area to start off with. Remember, flexibility is important. Make sure you're organized. You always want to be able to have that safe environment, clutter-free. You want to be able to see what problems can occur and how to solve those things. Remember, when you're cleaning and you're helping out, practicing your good body mechanics. You want to be able to make sure that you document everything that you do. You want to be able to use your time correctly and efficiently. Now, when we're providing cleaning, okay, there's a variety of products that we should know. This is pretty much Mr. Clean 101 course. And you have those all-purpose cleaning agents. You have soaps and detergents, abrasive cleaners, specialty cleaners, those non-toxic cleaners, which is also known as environmentally safe cleaning products. But remember, you need these additional cleaning products, not just water by itself, because water by itself does not clean things, always. Cleaning products, remember this, can cause burns or at the same time may be poisonous. So we want to be able to read the instructions correctly, okay? Don't just have things laying around. Make sure that you are aware about what problems can occur, what side effects that can happen to be able to monitor that as well. Now, when using cleaning products, like I said, read the directions. Do not mix cleaning products at all. Especially don't mix those Ajax powder solutions with the bleach. You'll be surprised how many people start having respiratory problems because they try to be clean by mixing some products, but unfortunately these are chemicals, and certain products mixed with another chemical can cause a lot of problems. So especially respiratory problems. Never ever leave cleaning products on surfaces. Okay, so when you're applying things, make sure you are able to rinse it out, remove it, okay? Also understand that for bleach, bleach is a great disinfectant, but you want to dilute the bleach. You want to be familiar with other environmentally friendly cleaning solutions. Where you have some people nowadays making their own solutions at home, mixing baking soda with lemon juice nowadays. Borax is another idea that you can use to be able to use to clean things, or to even to add that to your laundry to be able to make the product cleaner. You want to be able to honor their preferences. If they prefer to have those non-toxic solutions made up, then follow that. If they have certain items that needs to be purchased that they prefer, then do that. Now, when you're cleaning, cleaning should be done when the client is resting, not when they're awake, not when they're watching TV. If a client's resting, sleeping, that is your chance to actually do a couple work to be able to clean outside things. If we don't clean things, there's always probability of people getting infection or problems with the food or anything else. So we have what we call pathogens. Pathogens are those microorganisms that are capable of causing infections and disease. Not all microorganism causes disease, okay? There's a lot of good small microorganisms. Like yeast, for example, that helps out with wine, with beer, with liquor. If you are, pretty much trying to make some yogurt, for example, we use some good bacteria in there to be able to help the creation of yogurt. Okay, so these are Microorganisms by itself is not harmful, only specific types are harmful. There's also recycling. Some patients or clients might want to recycle. So the process of taking material that would have been considered waste and turning them into new products is important. So how can we help with recycling? So let's look at the proper cleaning methods for areas in the home. So in the living areas, always pick up the clutter and put items away. This avoids people from having to have small accidents like tripping on themselves. So you always want to make sure that you empty waste baskets to be able to keep things clean, odor free. You always want to keep frequent use items within easy reach. So if the client's always using their remote control, have that easily reachable for them, because one thing is it prevents them from falling at the same time as make things easier for them. You always want to be able to dust at least once a week at a person's home. If you're not aware, they said around 65 to 70% of dust at home is really dried skin. Okay? Other than dusting, you can go ahead and also make sure you vacuum once a week. I know a couple clients that they have those Roombas where everything just does it automatically, which is an amazing thing. Okay? I know a couple aides who bring their own Roombas to the patient's home so that they don't have to be vacuuming themselves nonstop. They can have this Roomba doing its work while they're caring for the client. Always make sure that you clean the floors. Okay, if the floors are wet, you want to be able to put some signals or signs that shows that it's wet to be able to avoid any emergencies of the client falling or any visitors falling. When we're talking about the kitchen, you want to be able to prevent disease by cleaning and handling the food properly. Okay, you don't want to be able to be cutting meat and vegetables in the same cutting board. Those things needs to be separate. You want to be able to check for pests. You want to make sure that the kitchen is cleaned after every use, and make sure you clean the refrigerator at least weekly. Wash the dishes with hot soapy water. If the client has an infectious disease, kill pathogens with heat and the bleach. Okay, so if they're infected, there's an infection going on. You always want to clean things out. You want to be able to store food covered and refrigerated quickly. You want to be able to vacuum, sweep, mop the floor almost on a daily basis. Dispose any garbage daily. Check for safety hazards. Store cleaning products away from food and children. Now, when we're talking about the bathroom, your bathrooms can be reservoirs for microorganisms. That's where mold and mildew can be seen at. Okay, because remember, your bathroom's dirty, dirty, dirty. Because also understand that, this is where you urinate, this is where you defecate, this is where you also wash yourself. Okay, and if you're not aware, when you are actually urinating, you're creating splashes and droplets. So it's actually bringing a lot of things in the air. Make sure that the toilets are scrubbed and flushed all the time. Scrub the tub and shower after each use. Okay? Whether you have to get those scrubbing bubble sprays, whatever you need to do to make sure that the tub is actually cleaned and sprayed as well every time it's used. If there's any large amount of hairballs in the drain, make sure those are removed, because eventually you see that getting clumped up and getting gooey. That's bacteria growing right there. You want to be able to prevent those. All towels should be hanged after it's used. Don't just leave it on the floor. Okay? You want to be able to rinse the sink every time you use it. Don't forget to using safety precautions, by using non-skid rugs. Okay? You don't want these rugs causing people to trip and fall and have accidents. Okay? If there's any puddles on the floor, make sure that's wiped right away. If need be, if the client needs assistance with standing up or sitting down, make sure there's grab bars readily available. Now, there's storage areas in people's homes. It depends on how big it is, or sometimes they choose one of their rooms to become a storage area. You want to be able to make sure you store any dangerous items there. You want to be able to make sure that things are reachable easily. You want to be able to make sure that things are cluttered free and does not cause any additional accidents within there. So moving on to infection prevention. Always use disinfectants. You always want to clean the patient's bathroom. Use those separate dishes and utensils for each client. You want to be able to wash dishes in dishwasher if that's available, or hot soapy water. Disinfect the surfaces and toilets always. You want to be able to make sure you remove the trash frequently, and if you need be, double bag any specimens, and at the same time store away from food. Okay. Now, there are times where you might be expected to do hand or machine washing as part of an assignment. You want to be able to clean the clothes, the bed linens, and towels, and it is very important for hygiene and comfort to be able to do these things. So, talking about laundry products and equipments, you want to be able to follow the instruction in washing machine lids. Okay, you want to be able to ask the client and their family about special considerations. Are there things that they're actually allergic to that you shouldn't be using? Do they want things done a certain way? Whatever happens, you need to be able to ask the questions. You need to be able to understand points about pre-treating stains or clothes, okay? When's the last time you pre-treated a stain of yours? Maybe not, maybe never. But when we're caring for clients, you need to ask these questions. Do they want us to treat them? Do they have stuff that they can actually give to treat these things? Now, bleach, on the other hand, is very good for disinfecting things. But if you're like me and did not know this, you're not supposed to use bleach for all fabrics. And I've learned that the hard way, unfortunately. And also, bleach is a good stain remover, but for a lot of white clothes only. If you start using bleach for colored stuff, well, you're going to see some changes and some problems, and you're going to be wasting some money. Okay? And then bleach, if you add that to warm water or hot water, it interacts better. For some reason, the heat helps it work better. Now, looking at water temperature, why is it important? On anything that we do or anything that we're using, or if we're adding anything to a hot water, for example, you need to read the instructions, making sure it's not too hot. When you're washing clothes, typically warm water works well with most fabrics. Hot water, on the other hand, works with towels, linens, and whites. Cold water, on the other hand, works with a lot of brightly colored fabrics. You always want to use that normal setting for most fabrics. You want to use slow or gentle settings for delicate fabrics. Now, when you're drying clothes, use the lower temperature for delicate fabrics and then higher temperature for a lot of the towels. Because if you use the low temperature, I'm sure you've done this at home, you'll be surprised that your towel is still wet. Now, for ironing and folding clothes, it all differs from agency to agency. Make sure you find out first if that is a requirement of you, of your staff. When they start talking about basic mending or sewing occasionally, this is just added extra stuff if you can do it. Not everybody took some home ec class like me, for example, such as being able to mend things or sewing things occasionally. So that doesn't mean you have to do it just because that it is needed. Refer to the client's family member if they have any suggestions or if your staff can actually do anything else for that. Now, remember laundry precautions when infection is present. If somebody that you're caring for in the house has an infection, we need to make sure that we follow these specific guidelines, keeping that client, their clothes, separate from other family members. Just because you wash it, that doesn't mean that there's no possible chance that spreading of infection may occur. You always want to handle the linen as little as possible. You always want to wear gloves and carry laundry away from the body. You want to be able to use liquid bleach and agency-approved disinfectants, and always make sure you use hot water. Now, when we're teaching family members about the care of the client, about being able to do things at the comfort of the home, we want to be able to know and get to know the family members. We want to be able to make sure we're patient, okay? We want to be able to keep those sessions brief so that they can go right to what they need to do. And the reason why they hired you and your team is to be able to alleviate some, items that they've been doing the past few weeks, the past few months for their loved ones. If we need to answer any questions, then answer any questions. If you don't know the answer to any questions that a family member may have or the client may have, best way to answer that is, I don't have the answer at this moment, but I know someone and I can find someone for you. Never ever just say, I do not know. Okay? Every time we're teaching the clients or the family members, each things that we teach them should be individualized for the care for that client. We can always refer to our homemaker, or we can always refer to our supervisors or managers to be able to let us know what else needs to happen. Now, when we are doing work at the patient's home or the caregiver's home, we always have to think about proper body mechanics. Once again, don't forget about bending your knees, not using your back when lifting things. You have to understand that we need to keep our body pretty much injury-free to be able to provide great care. And what we do right here can be, at times, unfortunately, heavy. We can do things that are heavy at times or lift things that are heavy at times. But no matter what, we need to follow our body mechanics because this decreases the chance of us actually getting, any injuries. So just moving on to additional things we need to know about body mechanics. These are great things to be able to know. Remember, don't lift heavy objects from the floor. Can you or do you need help from somebody else? Always make sure your body is well aligned. Okay? You want to be able to make sure that you are actually not going to injure yourself if you can't handle certain things. Okay, moving on to the 10th part, which is bed making. Because when we are caring for the clients and we get them up to a wheelchair, we get them up to the sofa, we always want to make sure that we actually work on the bed. Nothing feels better or better than anything where you go to your room and your bed is actually made. It's the best feeling in the world literally starting your night off with a made bed. So let's talk about a couple different terms such as occupied bed. An occupied bed is a bed made while the person is in the bed. An unoccupied bed making would be a bed made while the person is in bed. Okay? So, you know, if the person's not in bed, that's an unoccupied bed. An open bed is bed made with linen folded down to the foot of the bed, whereas a closed bed is a bed completely made with the bedspread and blanket in place. Okay? Now, let's observe the following if a client complains of lack of sleep. You remember sometimes as a homemaker, as a home health aide, you might be providing care 24/7. Or you might be providing care as the nurse that's working overnight. So if a client complains of lack of sleep, we need to look at several things. Are they sleeping during the day? Are they drinking too much caffeine? Dressing in night clothes during the day. Are they eating too late at night? Are they refusing medications for sleep? Are they taking new medications? Do they have the TV on, the radio, the light on late? Are they having any pain? We need to be able to investigate these several things to be able to figure out what's wrong with the client. So what happens if a client is not sleeping properly? Well, then there's going to have that decreased mental function. They're going to have that reduction in reaction time. They're going to have that increased reability. And there's going to be that decreased immune system, function. So one of the three main reasons why bed making is important is because at times damp and wrinkled sheets keep the client from sleeping well. So most of the time, just making sure we took care of the bed will actually guarantee that the client is sleeping well. And at the same time, the second one is damp and unclean linen will encourage infection and disease. Remember, a lot of pathogens love that dark, love that unclean, that damp area. Okay, they love and they actually live well in those type of areas or that type of environment. Sheets that are not flat increases the risk for pressure ulcer. Because those sheets that are not flat, they're wrinkled. Those wrinkled areas can cause pressure in certain areas and can cause chances of any pressure ulcer from building up. So think about this question. What examples from you or from your own home can you think of in which warning labels can be found on the containers of products you use? Most anything that is made of chemicals will always have warning labels. A lot of food has warning labels. Almost everything that we purchase has the warning labels, and we need to make sure we read those. Countless times we just look past the labels and not pay attention, and we should actually pay attention to it.